Some men nowadays find it very difficult to impregnate their wives and also find it very difficult to deliver sperm into our reproductive system. In this video, we'll be discussing of matters relating to male infertility. Male infertility is due to low sperm production, abnormal sperm function, or blockages that prevent the delivery of sperm, illnesses, injuries, chronic health problems, lifestyle choices, and other factors can play a role in causing male infertility. Not being able to conceive a child can be stressful and frustrating, but a number of male infertility treatments are available for you to make use of. How do you know that you are infertile in male reproductive? The main sign of male infertility is the inability to conceive a child. There may be no other obvious signs or symptoms in some cases. However, an underlying problem such as inherited disorder or hormonal imbalance, dilated veins around the testicle, or a condition that blocks the passage of sperm causes signs and symptoms. Although most men with male infertility do not notice symptoms other than the inability to conceive a child, signs and symptoms associated with male infertility goes like this. Problems with sexual function, for example, difficulty with ejaculation or small volumes of fluid ejaculated, reduced sexual desire or difficulty maintaining an erection, erectile dysfunction, pain, swelling or a lump in the testicle area, recurrent respiratory infections, inability to smell, abnormal breast growth, gynecomastia, decreased fascia or body hair or other signs of a chromosome or hormonal abnormality, a lower than normal sperm count, fewer than 15 million sperm per millimeter of semen, or a total sperm count of less than 39 million per ejaculate. You can see your doctor if you have been unable to conceive a child after a year of regular unprotected intercourse or sooner. If you are having erection or ejaculation problems, low sex drive, or other problems relating to sexual function, pain, discomfort, or lump or swelling into the testicle area, a history of testicle, prostate, or sexual problems, a groin, testicle, penis, or scrotum surgery. Male infertility is a complex process. For you to get your partner pregnant, the following must occur. You must produce healthy sperm. Initially, this involves the growth and formation of the male reproductive organs during puberty. At least one of your testicles must be functioning correctly, and your body must produce testosterone and other hormones to trigger and maintain sperm production. Sperm have to be carried out into the semen. Once sperm are produced in the testicle, delicate tubes transport them until they mix with semen and are ejaculated out of the penis. There needs to be enough sperm in the semen. If the number of sperm in your sperm count is low, it decreases the odds that one of your sperm will fertilize your partner's egg. A low sperm count is fewer than 15 million sperm per milliliter of semen, or fewer than 39 million per ejaculated. Sperm must be functional and able to move. If the movement, motility, or function of your sperm is abnormal, the sperm may not be able to reach or penetrate your partner's egg. Problems with male fertility can also be caused by a number of health issues and medical treatment. Varicocele. A varicocele is a swelling of the veins that drain the testicle. It is the most common reversible cause of male infertility, although the exact reason that varicocele causes infertility is unknown. It may be related to abnormal testicle temperature regulation. Varicocele results in reduced quality of the sperm. Treating the varicocele can improve sperm numbers and function, and may potentially improve outcomes when using assisted reproductive techniques such as in vitro fertilization. Infection. Some infections can interfere with sperm production or sperm health, or can cause scarring that blocks the passage of sperm. These include inflammation of the epididymis or testicle urchitis, and some sexually transmitted infection, including gonorrhea or HIV. Although some infections can result in permanent testicular damage, most often sperm can still be retrieved. Ejaculation issues. Retrograde ejaculation occurs when semen enters the bladder during organs instead of emerging out the tip of the penis. Various health conditions can cause retrograde ejaculation, including diabetes, spinal injuries, medications, and surgery of the bladder, prostate, or urethra. Antibodies that attack sperm. Anti-sperm antibodies are immune system cells that mistakenly identify sperm as harmful invaders and attempt to eliminate them. Tumors. Cancers and non-malignant tumors can affect the male reproductive organs directly through the glands that release hormones related to reproduction, such as the pituitary gland, or through unknown causes. In some cases, surgery, radiation, or chemotherapy to treat tumors can affect male fertility. Undescended testicle. In some males, during fetal development, one or both testicles fails to descend from the abdomen into the sac that normally contains the scrotum. Hormonal imbalances. Infertility can result from disorders of the testicles themselves or an abnormality affecting other hormonal systems, including hypothalamus, pituitary thyroid, and adrenal glands. Defects of tubules that transport sperm. Many different tubes carry sperm. They can be blocked due to various causes, including advertent injury from surgery, prior infections, trauma, or abnormal development, such as with cystic fibrosis or similar inherited conditions. Chromosome defects. Inherited disorders such as Klinefelter syndrome, in which a male is born with two X chromosomes and one Y chromosome instead of one X and one Y, causes abnormal development of male reproductive organs. Other genetic syndromes associated with infertility include cystic fibrosis, Kallman's, and Cattarines syndrome. Problems with sexual intercourse. This can include drop keeping or maintaining an erection sufficient for sex, premature ejaculation, painful intercourse, anatomical abnormalities such as having a urethral opening beneath the penis, or psychological or relationship problems that interfere with a digestive disorder caused by sensitive to gluten. Celiac disease can cause male infertility. Infertility may improve after adopting a gluten-free diet. Certain medications, testosterone replacement therapy, long-term anabolic steroid use, cancer medication, certain antifungal medications, small ulcer drugs, and certain other medications can impair sperm production and decrease male fertility. Primary surgeries. Certain surgeries may prevent you from having sperm in your ejaculate, including vasectomy, inguinal hernia repairs, scrotal or testicular surgeries, prostate surgeries, and large abdominal surgeries performed for testicular and rectal cancers, among others. Environmental causes. Overexposure to certain environmental elements such as heat, toxins, and chemicals can reduce sperm production or sperm function. Specific causes include industrial chemicals, extended exposure to benzenes, toluene, xylene, Pesticides, herbicide, organic solvent, painting material, and lead may contribute to low sperm counts. Heavy metal exposure to lead or other heavy metals also may cause infertility. Radiation and X-rays. Exposure to radiation can reduce sperm production, though it will often eventually return to normal with high doses of radiation. Sperm production can be permanently reduced. Overheating the testicles. Elevated temperatures impair sperm production and function. Although studies are limited and are inconclusive, frequent use of saunas or hot tubs may temporarily impair your sperm count. Sitting for long periods, wearing tight clothing, or working on a laptop computer for long stretches of time also may increase the temperature in your scrotum and may slightly reduce sperm production. Lifestyle causes. Drug use. Anabolic steroids taken to stimulate muscle strength and growth can cause the testicle to shrink and sperm production to decrease. Use of cocaine or marijuana can temporarily reduce the number and quality of the sperm as well. Alcoholic use. Drinking alcohol can lower testosterone levels, cause erectile dysfunction, and decrease sperm production. Liver disease caused by excessive drinking also may lead to fertility problems. Tobacco smoking. Men who smoke may have a lower sperm count than those who don't smoke. Secondhand smoke also may affect male fertility. Emotional stresses. Stress can interfere with certain hormones needed to produce sperm. Severely, a prolonged emotional stress, including problems with fertility, can affect your sperm count. Depression. Research shows that the likelihood of pregnancy may be lower if a male partner has severe depression. In addition, depression in men may cause sexual dysfunction due to reduced libido, erectile dysfunction, or delayed inhibited ejaculation. Weight. Obesity can impair infertility in several ways, including directly impacting sperm themselves as well as by causing hormone changes that reduce male fertility. These are ways on how you can prevent male infertility. Many types of male infertility aren't preventable. However, you can avoid some known causes of male infertility. For example, don't smoke, limit or abstain from alcohol, stay clear of illicit drugs, keep the weight off, don't get a vasectomy, avoid things that lead to prolonged heat for the testicle, reduce stress, avoid exposure to pesticides, heavy metals, and other toxins. Make sure you know the cause of your own infertility by undergoing fertility test with your medical practitioner. When the cause is established, find a solution. But if you find there is no cause, help yourself with nutrients that can boost fertility. If hormonal imbalances is the cause, balance your hormones with food that can balance hormones and put your faith in the infinite power of God. Thank you.